Okay, welcome everyone. Today our guest is Dr. Jane Alcorn. She's the Dean and Professor of the College of Pharmacy and Nutrition at the University of Saskatchewan. She has a Doctor of Veterinary Medicine from Western College of Veterinary Medicine and at the University of Saskatchewan, and the PhD that she received from the Pharmaceutical Sciences Department here at the University of Kentucky. So Dr. Alcorn established the Drug Discovery and Development Research Group within her current college, and also co-founded and co-leads the Cannabinoid Research Initiative of Saskatchewan, which is an interdisciplinary research cluster whose goal is to provide Canadians with the evidence-based knowledge needed to effectively and appropriately use medical cannabis. So welcome, Dr. Alcorn.
Thank you.
Thank you, Dr. Alcorn, for joining us. My name is Rupinder Kaur, and I'm a fourth-year graduate student in the College of Pharmacy, and I work in Dr. Graf's lab. Just to give a rundown, I'll ask a couple questions about your current position, and then we'll kind of work our way chronologically from your graduate work up until your current position. If that sounds good.
Yeah.
So can you describe your average day or your average week and how COVID has affected that in ways other than just virtual environment and shifting everything to Zoom?
Well, certainly as Dean, I haven't unloaded any of my previous responsibilities as a professor in the college. So my average week consists of activities that are related to the Dean. So, attending Dean meetings, attending to college affairs, solving problems, putting out fires, all those things associated with being the Dean. As well, I have quite a significant research program still to this date, and a number of graduate students that I mentor. And so every day there's always something associated with that research program. And I also do quite a bit of teaching. I teach 2 undergraduate courses and a graduate course over the course of the 2 terms. So right now I'm teaching a graduate course, and I just finished up teaching an undergraduate course. And so that's at least one thing off my plate, so that's helpful. So I think life as a dean still remains very much similar to life as a professor, but with the added responsibilities that come with the dean. So, every day it's just, you got your teaching, you got your research, you got your administrative responsibilities, and they all intermix from day to day. Yeah.
You became dean in 2019. However, you were acting dean prior to that. How has that transition affected your overall life balance, work-life balance, and the responsibilities of teaching and research?
Certainly, transitioning to the dean, I wouldn't say it increased my workload. It just shifted my workload, because prior to becoming a dean, I always had a fairly large administrative portfolio, because I was university veterinarian for some period of time, along with being a professor as well. After that stint was done, I remained the chair of the Animal Ethics Committee here on campus, and that is a very large portfolio. And so I always had that large administrative responsibilities. So becoming a dean just shifted those responsibilities. And I find that, throughout my entire career, I've always been carried a fairly significant workload, and always contributed as much as I could to the university environment and to my own college. So I always carried a fair bit of committee work and other type of responsibilities. So my work-life balance is one of, I work too much, and I forget that there's other aspects to life. But I say that a little bit facetiously. I do work a lot, but I do make sure I look after those other things that are important in my life. So, I have a grown son, so it's not like I have to worry about meeting his needs, although sometimes I feel like I have to continue meeting his needs. They never truly grow up, do they? I also have my husband, got to commit my time to that family dynamic as well. And, I am a veterinarian for a reason. I do have animals, and so I have to make sure I'm looking after my animals, etc. So to me, it's making sure I maintain those commitments, and in a genuine fashion. Maybe not as much time as I'd like to to spend with them, but certainly making sure I provide that quality time that they deserve. And then for myself, you know, I don't know what a hobby is anymore. What are hobbies? But I always make sure you have to look after your own wellness, and you have to decide what that is for you on a personal basis. And for me, it's making sure I have some level of fitness. So exercise is something I commit to every day. And so that is where any extra time that I have in a day goes towards. Without that, work-life balance would be very difficult. So, I mean, for students out there, if there's any piece of advice I can give you right at this moment in time, is you make sure you look after your wellness, because that's what keeps you efficient and efficient in your own in your work. You know, you don't have to work 16 hours a day. You could work 12 hours a day, but work it efficiently. And including wellness in that part of your day is what allows you to be efficient in that period of time that you work.
Right. Quality over quantity, always.
Exactly. Yeah.
So you finished your graduate work at University of Kentucky in 2002, and you worked with Dr. McNamara. What brought you to the University of Kentucky first?
Dr. McNamara.
Makes sense.
I'll get a little personal here. Before I started veterinary medicine, I gave birth to my son, and I encountered some health issue. I had a venous thrombosis that required me to take heparin during pregnancy, and then after pregnancy, warfarin. And the question I asked my doctor when we were talking about transitioning to warfarin was whether or not warfarin would transfer into breast milk. And my doctor couldn't answer that question. And that bothered me. So I made a decision that was probably not in the best interest of my son overall in terms of breastfeeding, etc. But it did get me looking online about trying to educate myself more about this issue. I learned very quickly that we didn't have a lot of research in the area, but that's where I found Dr. McNamara's name in some of the research I was looking into. And so when I finished my veterinary medicine degree and made the decision to pursue a research degree, I first did a master's, but it was again during my master's degree where I really did a deep dive into literature and realized I want to research this area. And I came to University of Kentucky first under the auspices of the toxicology program, but quickly transferred to pharmaceutical sciences for a number of different reasons, which I won't go into. But it was with Dr. McNamara that I wanted to work with initially anyways. Different decisions led me to start with toxicology, but I was able to transfer to Dr. McNamara. So it's his research area. And then during my short time I was in the toxicology program, I interacted a lot with the pharmaceutical sciences program and with Dr. McNamara, and realized what a quality individual this person was, not only as a researcher, but just as a human being. And I said, he has to be my supervisor. Yeah.
Yeah, that's totally understandable. Dr. McNamara is a treasure of the college.
Yes, he is. Yeah. Is he mentoring any graduate students right now?
I don't think he has any active students. He had a PharmD master's student. I'm not sure where he is in terms of finishing his work, but to my knowledge, that's the only one, and he's phasing into retirement right now.
Yeah. Well, that'll be a loss to the college, but I know he's done a great deal of outstanding. He's had outstanding commitment to college for sure. Yeah.
And we're having trouble finding someone to fill his shoes, for sure.
You probably will. Yeah, I don't know if anyone can truly fill his shoes. Yeah.
So after completing your PhD, you went straight into academia as an assistant professor at the University of
Saskatchewan.
Saskatchewan. Thank you. What helped you make that decision?
So before I even graduated as a PhD, I became a professor. So I was a professor before I was even a graduate, like a PhD graduate. But I had the opportunity to either go into veterinary medicine, because I was tacitly offered a position there, or the College of Pharmacy and Nutrition. I chose College of Pharmacy and Nutrition because pharmaceutical sciences was my true background, my true love as an area of expertise, and pharmacy and nutrition would fit that better. If I went into veterinary medicine, I would have actually started as an associate professor, because they acknowledged my DVM degree there. I started as an assistant professor in the College of Pharmacy and Nutrition, but it was my background that was the deciding factor. The deciding factor coming back to the University of Saskatchewan was simply my loyalty to the university. I did my undergraduate degree here, and even though it's a middle of the road type of university, it does get a lot of recognition. Having undertaken 2 degrees at the University of Saskatchewan, I had 2 high quality degrees from the university. And there's nothing, and I unless you live on the prairies, you just can't understand what it's like to live on the prairies. Some people visit the prairies and say it's boring because it's just flat, right? But there's so much to say about prairie and the community that's associated with prairie life. And I wanted to come back to that. Saskatoon, which is the city where University of Saskatchewan resides, is a beautiful city. And it's a mid-sized city. It's about 260,000 people, but you have a feel of strong community within the city, and the university provides a strong feel of community. And I'm thinking by now you're getting a sense of I like the idea of that feeling of community. So the opportunity presented itself to come back to the University of Saskatchewan, and so I didn't hesitate.
When did you learn that you enjoyed teaching and you wanted that to be a part of your career?
When I was a teenager, I was an athlete, and I had opportunity to coach from a relatively younger age, and I just love working with young people. And so coaching, I know it's different. It's not exactly teaching, but it in a way it is teaching. And then during my undergraduate program, did some a little bit of teaching TA through that process, and into the graduate program as well. When I was at University of Kentucky, we called ourselves super TAs because meaning that we had a lot of TA hours, but I enjoyed them all. I enjoyed doing that type of work. And so the joy of interacting with young people and just seeing their growth and knowing that you can make a difference in their education. I mean, it's a no-brainer in many respects. Yeah.
And we appreciate that it's a no-brainer. What was it in terms of your work? Is there a distinction between tenure and, so with the assistant professor without tenure and tenure, does that reflect in a difference of day-to-day responsibilities at all, or is that just a title?
It does, and I think all institutions are this way. To get tenure, you have to show that you meet the standards with respect to teaching and research. At this university, and I think it's true at other universities, they don't put much emphasis on administrative work. So you're given opportunity to focus on teaching and research, which is really the foundations of what you do in academia, right? All institutions have an academic mission, and you need to show that you're contributing to that academic mission in a meaningful fashion, both at an undergraduate and graduate perspective, and not only from from your academic program. So in our college, we have 2 professional programs for pharmacists and dietitians. So you're contributing to that, but also contributing to the education of graduate students, etc. So when you're starting out and you're trying to build your research program and you're mentoring students for the first time, etc., that's enough responsibility to think, to try to make sure you're meeting the standards for tenure. To add on administrative stuff, etc., that's just asking a little too much. So for any graduate student out there who is, thinking about academia as a place to land, know that, your first years when you're working towards tenure, it's all about teaching and research, and that you should be afforded the opportunity to focus on that as well.
You've mentored a long list of graduate students and continue to do so. How would you describe your mentoring style?
My mentoring style is one of, first of all, getting to know the student, getting to know their personalities, getting to know their strengths and weaknesses, and then working with them to build upon their weaknesses and try to capitalize on their strengths. I try to me, the acquisition of the degree is secondary, the PhD or the MSc. What's most important are the other skills, because it's the other skills that really will ensure a student's success once they're done their graduate degree. So I work towards their communication skills, oral and written. I work towards, you deal with different personalities, and some interpersonal relationships become natural to them. For others, it's more of a chore. So I create opportunities to work on the soft skills as I see that necessary for a particular student. And so I do emphasize the soft skills a lot in my mentoring. I must say, as dean, I don't pay as much attention to my students as I need to anymore. But when I was not a dean, I paid a lot of attention to my students. Every day I would be in the lab. We talk about the research. We talk about any problems they were having, etc. So I think being a mentor it's a everyday hands-on affair with students, and particularly if you're like me, I want to get to know my student. You can't get to know them unless you interact with them quite extensively. Yeah, and I'm sorry to say too that has changed for me in the past few years, because of my time is otherwise engaged in other things, and that eats me up inside. My students are still well taken care of. If you ask them today, they would go, yeah, no, I have a good supervisor, but it's not quite the same anymore. And I kind of miss that, but I still think they're getting adequate supervision. Yeah.
And what do you think is one of the obstacles that current graduates face? And what are some things that we can do in our graduate time to help prepare for that?
Well, I think the biggest obstacle today that graduate students face is just the marketplace, right? I mean, and it's a reality in many of our professions where, the available jobs once you graduate is slim in some ways, depending on what you want to do. So it is really important that you use your graduate studies time to do a number of different things for yourself. And so it is graduate studies, as much as you think you're really busy in graduate school, you have to find ways to acquire a very broad but deep understanding of your area of expertise, whatever that might be, but also acquire some working level knowledge of other areas of expertise. I know we talk about, the specialist versus the generalist. You do have to develop your specialty because that's what you're going to market, but you do have to be a generalist as well. You have to speak the language of other disciplines, because when you're in an interview, that's going to come across very clearly that you have that broader understanding of science or whatever the area that you find yourself in. The other thing too is you need to create opportunities for yourself to work on those things that you might not be very good at. Like for me, when I was a graduate student, I recognized the fact that I'm an introvert by nature, kind of shy. I'm no longer that way in an academic situation, but those are things I worked on. So when in my master's degree, as much as it almost killed me, I did 9 oral presentations because I hated standing up in front of a group of people to present. But the only way you get better at it is by doing it. And so find out what your weaknesses are and work towards those, and find the opportunity to work towards those various weaknesses. The other thing too is that you are, as a graduate student getting a PhD in whatever discipline you are, you're not alone. There are hundreds of other individuals who are exactly like you. And when there's that one job available, what distinguishes you from the other graduate students? So you need to find a way to distinguish yourself from others, and that might be by acquiring a different skill set. So I'm going to give you an example. I had a graduate student who did a master's with me and then moved on to University of Toronto to do a PhD. However, before she did that, she did a year-long, she wanted to work. And again, the job market is fairly tight. So I told her, if you acquire this skill set, and this was mass spec, this mass spec skill set, you're going to find it easier to get a job. So I gave her a project. It was extra, and she had to do a lot more work, but I gave her a project that gave her background in mass spec. And then when she graduated, she applied for a job at the, I forget the hospital, General Hospital in Toronto, where 3,000 other applicants applied for. She got it. And she got it because she had this extra skill set along with her current skill set. But that's what distinguished her. And this job required some understanding of mass spec analysis, et cetera. So that's just an example of how, you as a graduate student, you need to, you have your own set of expertise that you're developing in your own program. But what is it that you can do to help yourself distinguish yourself from other graduate students? Yeah.
And that, like stuff like mass spec and RT-PCR, that's research specific, but that's also just as important transferable skill as communication.
Yeah, exactly. So it's, I mean, we could bring up many different examples of things that you can do to distinguish yourself. I just wanted to illustrate that point. This graduate student had very strong communication skills, and that also helped her to get this job. But again, it's just that mass spec training was just that extra little oomph that gave her the opportunity to stand above others who applied for the same job.
So with time, you started getting more into administrative work, shifting into acting director of research ethics, and then working up to associate dean and now dean. What was the motivation for taking on more administrative and leadership responsibilities?
The initial motivation, actually, maybe I'm going to take a step back for a minute here. When I started as an assistant professor, I have a bad memory. So the fact I remember this as clearly as I do tells me how important it was to me. But I sat down at my desk in my office and I asked myself, what are the things I'm going to make sure I pay attention to no matter what? I'm going to focus on this and do the best darn job I can do in these areas. And 2 things came to mind: student mentoring and animal ethics. And so student mentoring, I mean, I'm humbly say this, I'm a good student mentor because it's really important to me. But animal ethics is something that is a passion of mine. So the use of animals for teaching and research purposes. And so my administrative journey began with animal ethics. And I joined the Animal Ethics Board within 4 years of my becoming first becoming a professor. And then a few years after that, the regulations around animal ethics at the institution kind of changed, and they had to create a new position. And I found myself an opportunity to apply for that position. So I did, and that position was a leadership role. And with that leadership role, it was on a smaller scale, and it was an administrative position. I was in that role for 3 years when the university veterinarian position became available. And I jumped into that position out of need for the university. So I'm a very service-minded individual. I serve, a lot of things that I do is to serve others. And the university was in dire straits in terms of trying to fill this very important administrative position, because in Canada, institutions can only use animals for research and teaching if they have what's called a certificate of good animal practice. And we were in jeopardy of losing that because we had this university veterinarian position that was not filled for 2 years. Since I had great knowledge of animal ethics program at the university and I had the veterinary background, I was able to jump into this position and become the university veterinarian for 5 years. That was a very large administrative position. It was that position where I really learned a lot of my skills. I won't go into it, but it was very interesting in terms of trying to navigate university priorities and regulatory requirements and academics, because academics don't like to be pigeonholed into any kind of regulatory scheme, right? But when it comes to using animals, you do have to follow certain processes and policies and etc. And so learning how to navigate that, and you have your university priorities, etc. I learned a lot in that perspective. So when I was done that position, I went and became an associate dean of research and graduate affairs. Again, in part because of my desire about educating graduate students. And I saw within our program the need to begin to, on a more wider scale, make sure our graduate programs were developing those other softer skills, because we hadn't had that in place in our graduate program. So my impetus to do the associate dean was to begin to put things in place in our program that helped build the soft skills within the graduate students, and other things too. So I was in that position for 3 years, and our dean was leaving. And so again, when our dean was leaving the college, I saw a need, and I felt, I've acquired a number of skills over the last 10 years through university veterinarian and associate dean, that I felt positioned to be ready to take on the responsibilities of the dean. But never did I ever think I wanted to become a dean. Never in my entire course of academia. But again, it was a need arose. I felt I was in a position to address that need, and therefore I applied for being a dean. So I think in some ways I'm a little less usual in terms of how I took my path along the administrative line, or in terms of administration, because for me it was always, there was a need and I felt I could fill that need. It wasn't, oh, I want to become a dean someday and work towards developing myself so that I could be a dean. I think I did that much differently. Yeah.
So in the position of the university veterinarian,
Veterinarian.
Veterinarian. Thank you. So there, you mentioned one of the additional skills being managing multiple parties and multiple responsibilities. What other obstacles or growing pains or additional skill sets did you develop within that role and in that transition?
I think, and I'm going to speak a little bit more broadly here too, and I'm going to revisit a couple of things I said. I think when you take on these type of positions, and if you don't have that skill, you definitely have to build that skill within these positions. But in my opinion, and I think you got this impression already, to take on these positions, you first have to have that willingness to serve. You have to put aside your own interests. You're there to serve the interests of your college, serve the interests of your university. And by the way, as a dean, you can't just serve the interests of your college. You have to serve the interests of the university, and you have to balance the two when those two things don't align. But you cannot serve your own interests. And so aligned with this idea is the willingness to collaborate and facilitate development of opportunities that enhance life of your faculty, that enhance your academic program, that enhance your research program within the college. Other skills that I had to learn, well, I have inherently these skills, but I also had to hone them being in the role of the university veterinarian, were things like patience and being a good listener and hearing. You know, you have to hear what people are saying to you, because when you hear it, then you can respond to it properly. And you need to be able to learn to interact with many different types of personalities, the good and the bad. Your interpersonal relationship skills are exceedingly important in these type of positions. You have to understand the politics of the institution. That's really important. And I'm not political. I'm so apolitical, but you have to make sure you navigate the political system. So it's really important also to understand what your values and principles are, because in the political environment, it's easy to lose sight of those values and principles, but you better make sure you know what they are and not compromise them, and simply find solutions to issues that don't compromise those values and principles. At my institution, we're not a very financially sound institution. Resources are not plentiful. So you really had to learn how to problem solve and critically think through problems and be very creative and find practical solutions without tapping into monetary resources. And so those skills got really well honed when I was university veterinarian, for sure. When I started that position, the vet college on campus was about to revolt. They had so many issues with animal ethics. It was alarming. So I had to learn how to be able to work a group of people towards a consensus, a group of people that had a lot of issues with the program prior to my stepping into it. So the skill of persuasion was very important, and to do so without creating serious conflict. You can be persuasive and people don't have to agree with you, but as long as they could see the practical and reasonableness of what you're suggesting, you can move people to a consensus that everyone can be comfortable with and agree to. The other thing too that I found was it was very important that I understood my strengths and my weaknesses, and to capitalize on those around me when I found that I just didn't have that sufficient skill set to rely just on myself. And so it was being able to go outside yourself or convince yourself you don't have to be everything. You can rely on people around you. And that's actually a good thing too, because everyone in their positions, they work, many of them work in a way where they're proud of what they're doing. And so you reaching out to them and saying, look, I need some help here is only an affirmation of the things that they take pride in, right? And so creating that environment where people feel valued and can contribute in a meaningful way beyond just their own, what they're doing for their job, I think is very powerful. And that was something that I learned during my time as university veterinarian as well. I think those are some of the big things. Yeah.
No, I appreciate those insights a lot.
Yeah.
Before we move on, I think Noah has a quick question.
Yeah, I had a question. It's kind of specific, but so I do research on pharmaceutical outcomes and policy, and this is only humans. So I am a pharmacist, and I have, worked in a pharmacy, and I took clinical veterinary pharmacy practice. And I just don't see any research being done on this at all in the United States. And I think that there's a huge gap. And I just really would love to hear your perspective on what you think would be some, like, if you were to, suggest any sort of topics, or what do you think are the big gaps that aren't being filled already?
Well, the problem with veterinary clinical pharmacy is that many of the drugs that veterinarians use are off-label. You do have some pharmaceutical companies or that have a animal pharmaceutical arm. They will do the research necessary to ensure that a drug is labeled specifically for the species. But you can appreciate with veterinary medicine, you're dealing with a multitude of species, and they're all different. So a medicine that works in one species will not work in another. A medicine at one dose in one species, if you apply it at the same dose per body weight in another species, you'll kill that animal, right? So there's just too many different. It's too broad. It's difficult to commit the resources necessary to truly build a what we take advantage of with human medicine, where we know what drugs work and the doses they work at. Think about trying to do that, taking that same approach for every single individual veterinary species. That's not amenable. At the University of Saskatchewan, because we have the veterinary school and we have a pharmacy school, we actually have some of our pharmacy students who do placements in the vet school pharmacy, and they learn about veterinary pharmacy. And so maybe one of the things you could do to begin to build some kind of program around veterinary pharmacy is just encourage rotations in veterinary pharmacies, and use that as a means to begin to understand what are the needs and the gaps. I can't tell you exactly what the needs or the gaps are, because I'm not a pharmacist, and I don't constitute myself as a true veterinarian either, because I've not practiced veterinary medicine. University veterinarian, there was an ethics position, there was an administrative position. Did a little bit of clinical veterinary work with that, because at the time I came on board, we had just me. We lost our clinical veterinarian, so I had to do a little bit of that work. But the biggest gap is just knowledge of how drugs work in this specific species, so that you can begin to move away from the off-label use of drugs.
I agree with you. I think that there's like a paucity of primary literature on especially kind of this dose response among different sorts of species. But it is concerning too, because I just see that, you know, having worked in retail, people are getting drugs for their dogs and cats all the time.
Yeah.
And there's just really nothing, you know, we kind of praise this evidence-based science. And, you know, that's kind of the whole thing with humans, is that we, you know, if there's nothing to support this, then we won't do it. But there's all of this drug use going on that involves non-humans and is totally unmonitored, and there's no scientific evidence behind it. So
Yeah,
I think that's an interesting kind of niche in the market.
it is. I mean, the evidence is just from evidence of use, right? So with clinical use, you begin by trial and error to understand whether a drug works or not and what dose you work it at. Like, I have a cat right now, he's in renal failure. So for several years, I had him on a drug called Sementra. I forget what the name, the chemical name is. There is no evidence that it actually worked in cats. My cat's still alive. He's been in renal failure for 4 years, I think. So does that mean that that drug is working? It's a protein sparing drug. So is it working? I don't know. Cats are known to go into renal failure and live for a long time without any intervention. So I see your point, but I'm going to bring up an analogy here. Cannabis is not different right now. We have people who are using cannabis for any number of indications, and there's no evidence for it. There's anecdotal usage where I think one could argue that it does have some benefit in pain, certain kinds of pain. It does have benefit in epilepsy, etc. But the evidence is not there. So basically what you're talking about in veterinary medicine, we're seeing it in humans with cannabis.
This is a perfect transition. And what I was going to ask you about next is, so you do co-lead the Cannabinoid Research Institute. How did you help develop the institute, and what does that process look like? And similar to what you, or you mentioned some of that motivation of just lack of information right now, and what were some other motivations for that?
Well, so we're called the Cannabinoid Research Initiative of Saskatchewan. It's a virtual institute, if you wish. We're a research cluster composed of individuals from the University of Saskatchewan, University of Regina, and all across the world. We have individuals from everywhere. But the motivation of creating that group initially happened about 4 years ago when I was working with a pediatric neurologist, and we were trying to look at the use of cannabis-based medicines for pediatric epilepsy. So those epilepsies that were refractory to standard of care treatments. And so we did a trial. And as we were working through this, and it was a very difficult trial to do, but we were successful with it. We talked about the importance. We saw cannabis coming, looming in the future. Canada was going to regulate cannabis, etc. So we saw this need of developing a research group so that we can provide the evidence base to support cannabis use in those indications where it would be effective. Cannabis, and also to provide the evidence in those indications it's not effective in, right? And at that time, there was no other research group that was other than individual researchers that were kind of addressing this issue. So we formulated this group, and we drew together a number of individuals with specific expertise. Most of us had no cannabis background. A few of us did. So my college had recruited a research chair, and his area was cannabinoid pharmacology. So he was very important in terms of helping us build that group, because he sort of created the validity to research in this space. and the rest of us just use our expertise to in the various projects that we are working on right now. So it grew out of the need because of the looming legalization of cannabis in Canada, and the need to provide the evidence, because with legalization meant access, and people are using recreational cannabis for medical purposes. Medical cannabis was accessible in Canada since 2004 or 2001. We had some regulations around that. You had to get authorization from a physician, but it was always accessible. But it was the legalization of recreational cannabis that provided that impetus, because we knew that people would have access and would use it for non-recreational purposes.
It's interesting. I've noticed that there is often this sort of taboo with doing cannabis research, but this is becoming more and more important. I'm from Colorado, and we legalized marijuana a while ago, and like one of the uses for it that just patients or public has found is it helps with morning sickness in pregnancy, but we have no clue what that will lead to. And we're starting to see some of that data of what happens to the infant when the mother is using marijuana and cannabis products.
Yeah.
So
one of the first things we did as a group was we worked with our, what's the unit called? Anyways, the unit that puts out legislation or recommendations for not using certain medications during pregnancy and breastfeeding. And we created a poster that for the public that says, don't use cannabis during pregnancy. Yeah, trying that as a deterrent, because you're right. It is very common knowledge that it is good for morning sickness. And even talking to some social workers and other healthcare professionals in my province, they were always recommending cannabis to pregnant women. And you go, how can you do that? Oh, it's because it's natural, it's safe. No, it's not safe just because it's natural. So do you know Alan Shackelford? Have you heard of that name before?
Does not ring a bell.
Have you heard of Charlotte's Web? So yes. Charlotte, yeah. So he was the doctor involved with that. And he's actually part of our Chris group as well. He's a member of our group. Yeah.
Well, I'm glad you guys are embarking on this endeavor.
Yeah. But in Canada, this is Health Canada. So that's the same thing as your FDA or whatnot. The regulations they're putting around testing of cannabis in humans is becoming a very significant barrier to making any progress in this area. So as an academic, we need to have a research license, cannabis license. And we decided that instead of getting a bunch of individual licenses, we would go as an institution. So we put together an institutional cannabis research license. It took 1.5 years to get approved. And it got approved just before Christmas. So we were waiting for a very long time to be able to embark on some of the things that we wanted to embark on. We now have that approval, and now we're ramping things up again. But it used to be the case where Canada was in a position to sort of spearhead a lot of this evidence-based research. It's falling behind because of the regulations that Health Canada is imposing on cannabis. Yeah.
So I've gotten a lot of patients that are dogs, particularly, with questions about, is CBD a reasonable option for treating, sort of pains and stuff? What is your stance on the use of cannabis in animals with or without any sort of evidence to guide that decision making?
my stance is always don't do it. You need evidence. We are actually in the process of doing that. We're doing some safety evaluations in dogs with high CBD products, and we did a pharmacokinetic study in dogs just to get some understanding. The next thing we're looking at is a clinical study where we're looking at high CBD oil in dogs that underwent knee surgery to see whether or not it has any benefit in acute pain management. But again, you have two issues with that. Again, don't use something that there isn't good evidence to support it. That's how I default to that. And secondly, we also did a study where we evaluated the available veterinary products that are high CBD products. So you get a veterinary product, it says, it has 100 milligrams of CBD. We analyzed those products and we found a lot of variation in CBD content in those veterinary products. Which is a little alarming. And I don't think the situation would be any different down in the United States. So that's the other problem too, is even if you want it from an observational perspective, understand whether something is beneficial. You have the problem of product quality. And so if you're giving a product and you're dosing your animal and you're basing it on the label on the product, you don't, in reality, the dose that you're giving the animal is not what you expected or think it is. And so then how do you correlate the outcome with the dosing that you're giving, right? So that's another issue that we face with cannabis.
So we do only have a couple minutes left, and I want to respect your time. The last question, or the second to last question I want to ask is, for students that are thinking about going into academia, do you have any words of wisdom or advice to offer?
Make sure you want to go into academia first and foremost. Okay, academia is more challenging today. Institutions, I think everywhere, are feeling a financial pinch. It's harder to get grants. There's less money available to get grants, and so you have to want to be an academic, because you're going to find that you're going to have to work hard, really hard initially, to be able to establish yourself, establish your research program, get the grants, and you're going to be writing grants all the time. So you have to want to do that. There's no there's no silver lining, or there's no, what's the term they use to think when you think there's, anyway, it doesn't matter. It's hard work being in academia. It's very rewarding too. So don't get me wrong. The academia is wonderful because you have that flexibility, right? You have that academic freedom, where a lot of jobs don't afford that. And if you think about academic freedom correctly, which I don't think many people do, it's wonderful to be able to pursue whatever it is that you're interested in. So first of all, my advice is make sure that that's the right choice for you. And then secondly, make sure that you are well developed in terms of all those soft skills too. You may be coming out of the lab, you may have had a postdoc experience in a lab that had lots of reputation, etc. So your research area that you're going to propose as an academic might be very exciting, etc. But you have to demonstrate that you're going to be an individual that's going to be a strong teacher, that's going to be a strong mentor, that's going to be a person who contributes to the college, who contributes to the university, is a person who's going to be a team player when they need to be a team player, etc. And those traits come out very quickly in an interview process. So take the time as a graduate student to develop those other attributes about yourself. And if you do, you'll find those interviews will go very well for you and will put you in a position to be the successful candidate in academic environment.
Thank you for that. Is there a question that I should have asked you and have not yet? It's okay to tell me I did an amazing job.
You did an amazing job. I mean, your list of questions were very well done, and I'm hoping that my answers will be helpful to your graduate student body. I mean, sometimes only certain things come to mind, and you walk away from things and go, oh, geez, I wish I said this, or I wish I said that. But hopefully what did come to top of mind today will be helpful to all of you. The other thing too is, maybe one other thing I want to add is, you know, I've never been one to say that I have a role model, because I would say that I look at different people and I see their different attributes and go, oh, I like that attribute in that person. Or then someone else comes along and go, oh, I like that attribute. So I haven't had any single one role model, but I think it's important as a graduate student either to have a role model, or do it how I've done it. Look at different people and some of the really high quality attributes that they bring, and then aspire to acquire those attributes yourself. And that's work. That's a lot of work. And so you have to have that willingness in graduate school to go beyond just, you know, your typical task. Oh, I got to run this experiment today, and it's going to take me all day to run this experiment. I'm going to be tired when I go home. I just want to play some video games, etc. You have to, I mean, downtime is important, don't get me wrong, but you have to take the time to know that your graduate school is all about preparing yourself for the next step, and therefore take the time to undertake those preparations.
Thank you. I really appreciate that. And I appreciate your time.
Okay, well, I'm glad I was able, that you've reached out to me and you wanted me to, you know, spend some coffee time with the graduates. And I just want to extend all my best wishes for all of you. I hope you have a successful graduate program, and I certainly wish you all the success in your futures.
Thank you so much.
Okay.